Hi there. My name is Dr. Mackenzie Paulson.
And I'm Martika Muñez.
And we both work for the Anamosa Veterinary Clinic in Anamosa, Iowa. I'm a veterinarian.
And I'm a veterinary technician.
And we're here today to chat with you guys about our jobs and how some concepts of science and technology, we use them every day during our jobs. So to start with, in the veterinary profession, there's a lot of different things you can do. So like us, we work in a private practice, but you can also do things like work in research or military. You can do food safety and inspection, work with horses in the performance industry like racing. You can do things with aquatic or zoo animals, even teach in colleges and work in more of the sales sector where you can work with pharmaceutical companies and equipment.
Yeah, and the kind of the things we touch on within our kind of vet clinic kind of are the same, and kind of like doing research, working for the military or like a zoo or something. You still kind of have the hierarchy of the veterinarian with the vet tech kind of helping kind of assist with those procedures and whatnot.
And so ways that we use the concepts of STEAM in our practice. So with science, you know, that we do a lot with anatomy, physiology. We work a lot with biology, with the medications and things we prescribe. That's pharmacology, uses a lot of chemistry. We even use physics in some parts of our job. For technology, we use a lot of things like x-rays, ultrasounds, blood machines, microscopes, even surgical lasers. And then when it comes to kind of the engineering portion of it, that we use it a lot, especially when we're dealing with broken limbs, fracture repair, because we're using pins, plates, screws to kind of put things back together. Even engineering the use of splints or casts in animals and trying to kind of use your materials to make something fit your individual case. The arts is something that I think applies mostly to soft tissue surgery and like suturing, because a lot of that is like kind of cosmetic. You want everything to be symmetrical and look nice and pleasing to the eye. And with math, we use math every day when we're figuring out medication dosages or anesthesia for pets.
And then our pictures here, we have an ultrasound and a microscope, which would be some of the machines we use kind of daily, and then even kind of a large animal kind of restraining device. We use the chute system.
So for our education as a veterinarian, I went to 4 years of undergrad at Iowa State and then followed up with 4 years of vet school. You can do an optional 1-year internship and 3-year residency, which I didn't do, but if you wanted to become board certified or special or like a specialty, that's what you would do to go down that route.
And for the vet tech, I did a 2-year associate's degree at Kirkwood here in Cedar Rapids. And after you get your associates, you take a test to become registered. And then after a couple of years in the field, you can get specialized in the different aspects like anesthesia or radiology. Kind of takes a lot of researching and kind of having experience to get that. So that is an option after.
So we work at a mixed animal practice. So we spend part of our day working with small animals and then large animals. So on the small animal side of things, as a veterinarian, I spend a lot of time talking to clients about their pets, talking to them about what we're diagnosing and treating. We give vaccines, we perform physical exams. We do operate as kind of an emergency clinic. So we get a lot of emergency cases coming in, like hit by car or things of that nature. And then obviously working with medications and prescribing those.
And then the vet tech, we kind of do a lot of the kind of assisting aspects where we restrain the animals for the veterinarian. We kind of get all the supplies gathered. And then we also do a lot with like our own kind of science and technology coming into play, where we run all the tests and we gather all the specimens, whether it be urine, fecal, blood. We use all the various machines to run those tests. And then we can also use math to kind of help the vet when they're prescribing medication. We have to kind of count all of those and know, like, if they want this medicine for however many days, you know, how many pills they need to cover that time span. And so, yeah, our job kind of goes hand in hand with just kind of assisting in all of the day-to-day tasks.
And then for the large animal portion, a lot of it's very similar. We're just working on different species. So we're still giving physicals, we're administering treatments. We do herd work where we go out on the farm, we'll check for pregnancy using ultrasound, give vaccinations, castrating, dehorning. In the springtime, we see a lot of OB calls, so we'll help with delivery of baby calves, baby lambs, kids for goats, even do C-sections when necessary. We work with lameness issues and obviously emergency calls. That applies to large animal as well.
And then here's a good picture to show, like, I'm holding the animal for the doctor. This is a goat where it's got a broken leg, and so we're putting a cast and splint on it. And so my job is to restrain the animal, kind of keep it still for her to be able to effectively apply that splint. And then similar to the small animal, we do a lot of restraint, sample collection. Here's some more of the cute animals we kind of work with daily. And we can help with vaccines and kind of organization of the work.
And so for another big part of our job as a veterinarian, we do a lot of surgery. This is a picture of myself doing it's called a pyometra surgery, which is basically an infected uterus that we're removing. So make sure to spay and neuter your pets because you want to prevent that from happening. But there's a lot of other surgeries that we can do as well. So besides spays and neuters, we do some declaws, we do lump removals, amputations, we'll remove eyes, fix lacerations. I kind of mentioned we do some fracture repair, soft tissue surgery. We remove foreign bodies from animals if they eat something, and C-sections quite a bit as well.
And then the technician kind of prepares all of those surgeries for the veterinarian. We again will use a lot of math to figure out the drugs to sedate the animals, to be able to intubate them for surgery, or even post-op care. You know, we have to get the antibiotic and pain injections kind of done before the animals wake up from surgery to have those on board. We also have different machines we set up for the vets to use, like lasers, cautery, and we do even have like post-op lasers. And then afterwards, the technician will do kind of all the paperwork and medication gathering for the pets to go back home.
So one way we thought we could show you guys kind of how we can apply these concepts in day-to-day practice is to go through a case study. So I'd like you to meet JT. He is an 8-year-old golden retriever, neutered male, and he has a very long history of eating random things out of the garbage. So JT came to us the other day because he had been vomiting for several days. So first thing we're going to do is a physical exam. And here's a little video that kind of shows how to go through a physical exam. So if you're at home and you have your pet dog or cat, feel free to follow along, and you can give them a good look over with me. Hey JT, you don't feel good, huh? Got a bellyache. All right, we're gonna give you a little physical exam now. Take a look at your ears. Check your eyes. How's that gum color, huh? We'll check your capillary refill time. That's good. Okay. We're gonna check your lymph nodes. Good boy. Good boy. We're gonna take a listen to you, okay? So part of when we do physical exam, we like to check for heart rate and respiratory rate. So one way we can kind of use math to do that is when we count their heartbeats or respiratory rate for 15 seconds, we can take it times 4 to equal the beats per minute or breaths per minute. So I'm going to take a little listen here. So in 15 seconds, I got 20 heartbeats. So 20 times 4 is... So now we're going to do the same with his respiratory rate. So we're going to start a timer, and I want you to help me count the breaths, okay? So we're going to start our timer again here. All right, so we're going to start counting. So how many breaths did you guys get in the 15 seconds? Okay, so if we counted 5 breaths during the 15 seconds, 5 times 4 is 20, so that would be 20 breaths per minute. So that's a good example of how we use math during our physical exam. Next thing we're going to do is we're going to feel his abdomen. So because JT could have eaten something bad for him, we're going to see if he has any pain. Now, I'm going to take another quick feel of some lymph nodes. Take a look at his skin. Okay. Now the last thing we have to do is we have to get a temperature on JT. Sorry about that, buddy. Okay. Good. Temperature is normal. All right. So now it's time for some diagnostics. Awesome. So that was our physical exam on JT, which, side note, he was not sedated or anything. He literally hopped up on the table and just laid there for the whole thing. So
yeah. And that kind of shows too, when they don't feel good, sometimes they kind of will show you in that kind of way where they won't be super responsive. They'll just kind of lay there, like kind of pouting, like, yeah, I don't feel very good. Mm-hmm. And so here we can see kind of where we'll start running a couple of diagnostics to see if we can get a picture of what's going on with JT. And so we're going to draw some of his blood, you can see, and then we'll use these machines here to evaluate his blood and see if anything's going on organ function wise, or red and white blood cell count, which the veterinarian would analyze for us after our tests are done running. And then another thing we like to do is take x-rays and see if we can see anything clearly going on. So we have JT positioned here. Again, he is very cooperative, and so he just kind of lays on the table for us. Sometimes it'll take multiple humans to hold down a dog this big, but he's ready for it. And so we got the x-ray position to take an x-ray of his abdomen and see if anything's going on in there. So this is an example of what a normal x-ray would look like. The one on top is the normal set of heart and lungs in a dog. The one below is a normal chest abdomen actually in a cat, but it looks very similar. So you can see where the stomach, the intestines are all kind of located, kidneys, liver. And so keeping that normal in mind, we take a look at JT's x-ray, and wow, there's something right off the bat there. So that big arrow is pointing to some strange looking substance in the stomach. And so at that point, with how sick that JT was and with his history of eating things, we said, you know what, it is time for surgery. And so here again, we kind of use our math and science skills to use medication to sedate JT and get him ready for surgery, where he'll be intubated. And then you can see in that right picture there, he'll be hooked up to the anesthesia machine, which will keep him regulated under surgery. We can monitor his oxygen and heart rate and stuff while he is under. And then here you can see we're getting him positioned to kind of get ready to get prepped for surgery. So if anyone had any fun guesses to what that is that came out of his stomach, found out that JT ate an entire package of hair ties out of the bathroom. So this is what some of those look like coming out of the stomach. But we were able to remove all of the hair ties and sutured him up, and he recovered just beautifully. So he's back to his old tricks now. So some common questions that we get, what do we like most about our job? And then what do we like least about our job? And so for myself as a veterinarian, the thing I like most about my job is probably the variety of things that we get to do within a day. It's really, really broad. So everything from surgery to working with small and large animal patients. I really like the fact that no 2 days are the same. And to kind of go along with that, you know, what I like least about my job is because you can't plan for everything, we often work a lot of long hours. So I, on average, work probably 50, 60 hours a week with some on-call. So, you know, getting called at 2 a.m. to come in for
a sick animal is not always fun, but it's part of the job. And I still wouldn't imagine myself doing anything different.
Yeah. And for me, I really enjoy being able to kind of use what I learned in college and kind of in my vet tech kind of world, using it in my job kind of daily, and feeling kind of like, you know, I'm working to my best ability, kind of helping animals, feeling like I'm helping these animals get better. And so I really enjoy that, kind of being able to help something that's really in need and can't always speak for themselves. And then what I like least about my job, as you can see here in this picture, that's a lot of vomit from a dog. And then I am tasked with cleaning that up. And that's kind of the other side of the coin. You know, you get to do cool blood draws and get medication ready, but you also have to clean up the poop and vomit after the vet leaves the room. And so,
which this was actually a picture taken, was shortly after Valentine's Day. A dog ate a very large amount of dark chocolate. So
don't let your dogs eat chocolate, because then they have to throw up and I have to clean it. And it's really gross and gooey. So not fun.
So some things what can you do to prepare if you were interested in becoming a vet or a vet tech? What can you do right now? So number one, work hard in school and learn how you can study best for yourself, because everyone learns in a different way. And so learning how you study most effectively is really important. Taking a lot of science and math courses is obvious, but in a non-corona type world, something that's really helpful is actually get out there, call your local vets and ask to do job shadows, and just spend some time in the practice and see if it's truly something that you want to do.
Yeah, and kind of similar for vet tech career. You know, in high school, you kind of really do get all of those kind of stepping stool or, you know, stones to know what works best for you. You're going to get a lot of work thrown at you in college, and if you're struggling even to just remember all of it, that's gonna be hard. And so really figuring out your best way to remember things and learn them will really help you. And then definitely doing internships and job shadows. When I was younger, I always thought, I'm going to be a vet. That's what I'm doing. And that was my track all the way up until I was a senior in high school. And then I did a job shadow and an internship, and I was like, I don't want to be a vet. I really like the aspect of assisting and restraining and running tests. And I don't want to do all that brainy, smart work. And so you can kind of really see more what your jobs are going to be doing those job shadows. So definitely very helpful in the long run to do those.
So thank you very much for listening to us. And there's our contact information there on the screen. If you guys have any questions or anything, and you're more than welcome to reach out to either of us. So thank you.
Thank you.